Buffy York, and I'm here at Dr. Warren Seiler's office at Seiler Skin in Birmingham, Alabama. And I'm here today to find out more about CoolSculpting. We're moms, we're super busy, we do exercise, but we all like to eat. We're normal people. We like cookies, we like wine. I love a piece of coconut cake from Bottega, and I got a little extra love around the middle. And hopefully CoolSculpting is something that will work for me. Won't you come along with me while we find out more about this subject today? Okay, so we're here with Katie, the rock star of CoolSculpting at Dr. Seiler's office, and Dr. Seiler, and we're just going to answer a couple of questions for y'all. So I've surveyed a lot of my friends, and most of y'all, most importantly, want to know is what happens to your body after you have CoolSculpting? What happens if you gain weight, or after you have CoolSculpting? Where does the fat go?
Sure, that's a great question. So CoolSculpting works by freezing fat without damaging the other tissues. So your skin and muscle are left alone. It will kill fat cells, so it is permanent. But you've got to remember that whether you're 20 pounds heavier or lighter or 50 pounds heavier or lighter, you have the same number of fat cells. So if we remove 20% of the fat cells in a small area and you gain 20 pounds, that fat is going to enlarge somewhere else. So you want to stay in shape, you want to stay on your diet. It's to help you get rid of that last little bit that's difficult to do with exercise and dieting. But you can gain weight afterward, and it can go somewhere else. It can go to other areas that weren't treated. It can go to your legs, your arms, your face. So it definitely should not be looked at as a weight loss solution. Right. It's an awesome treatment, but it shouldn't be for weight loss.
Right. So don't get crazy with the ho-hos.
Right, exactly.
Okay. So next thing is, what can people expect like the next day? What are they going to feel like? What's going to happen?
That's a good question. Most of our patients always ask that. So typically the next day, you can work out if you need to, or if you want to, you probably should. When I personally had it done, I had it done later in the afternoon, so I kind of just wanted to go home and rest. Mm-hmm. But most of our people who are coming in for stubborn fat and to treat that stubborn fat, they want to know as soon as they can work out. You're not going to feel sensitive on the inside. You're not going to feel like you've had an intense workout. It's going to feel sensitive to the touch, so you can certainly do your normal routine, normal exercise the next day. You just may notice if you brush up against something or touch a treated area, you're going to feel a little bruised. So a little sensitive, but certainly you can work out.
And do you feel bloated for a week or so?
Yeah, I would say that feeling lasts anywhere from a week to a few weeks, and you feel like you've either eaten a lot of pizza or for females, right around that time, you just feel a little bloated.
Okay.
Goes away very slowly, but it will last for a good week.
When do people feel the full result, or when do you get the full results?
I personally saw results around 3 to 4 weeks, and then my optimal results sort of plateaued right at that 15 to 16 week mark. Normally you peak anywhere from 3 to 4, and then again 12 to 16. But I always say give it that full 4 months to see what area was treated to see the best result.
Okay, awesome.
It's pretty cool at a month though. She's right. Like I said, I had it 2 months ago. And you can tell that it's working because at about 4 weeks, so it's like, it's not hard, solid fat anymore. It's really starting to kind of break up. It almost kind of feels a little liquidy and mushy, and you're like, I can tell that once my body excretes that it's going to tighten up nice. So.
Awesome. Okay.
You go from not having to lay down by buttoning your jeans to being able to comfortably doing it standing up.
Oh, okay, great. And so what do the scales say? You got to be able to tell the scales?
I always tell people don't look at it as the number of pounds being adjusted by CoolSculpting. It's going to be more measurements and waistline and just the overall. You're going to feel better in your clothes. Now, obviously, it for me made me way more motivated to work out, to eat better, to maintain a healthy lifestyle. So I did see a pretty great weight loss as far as that being changed. But you don't want to look at it as that. It's more of a motivation to continue to eat better and continue to work out.
Sure.
Yeah.
And I know as far as I'm concerned, we're going to go in for the love handles and right here at the little belly area. But I've talked to a lot of other people that are interested in like the bra fat and things like that. What all areas are treatable?
Honestly, it's FDA approved for almost every area of the body. Bra fat, upper and lower flanks, which is right in here, your abdomen, outer thighs, inner thighs, submental, which is a big one. People kind of forget that is a treatable area. The little space above the knee, and also for women, the little thing above or right below their butt.
All right, where you can put the pencil.
Yes.
All right, okay, all right. All right, well, good deal. I think we've answered all the questions that we needed to answer, and let's move on to the next step. totally hooked up to the CoolSculpting, and this is where all the magic is happening. And I'm very comfortable. I'm really cozy actually right here. I'm about to start listening to my S-Town podcast, and I'll see y'all a little skinnier a little later.